parasympathetic do kind of have the same effect as the effects at the beginning, that all of the drugs have relatively the same effect. Okay, so we're going to learn about the effects at the beginning, and then we're going to focus on the other part, which is the names of the drugs and the clinical uses, to be specific. Okay, so just as a side note, the drugs that inhibit the muscarinic antagonists, or the drugs that inhibit the parasympathetic, do kind of have the same effect as the drugs that can activate the sympathetic. Okay, does this make sense, guys? Drugs that can inhibit the parasympathetic and drugs that can activate the sympathetic have relatively the same effect. Does this make sense? Let me give an example. Now, guys, help me out. Speaking of the heart, what's the parasympathetic effect on the heart?
Low heart rate.
Thank you, Safa. It's a decreased heart rate. Now, someone else, can you tell me what's the effect of the sympathetic nervous system on the heart?
Increase the heart rate.
Thank you, Zainab. So it's increased the heart rate. That's right. So you see, they're opposite. Now, if I inhibit the parasympathetic, what's going to happen to the heart rate?
Only spike up?
Exactly. It will increase. So, what about if I activate the sympathetic? We just said that it will also increase. So you see, they have the same effect. Okay, almost. Not in every organ, but almost every organ. Okay. Why is this important? Later on, you're going to see that sometimes we use them in combination in certain diseases. Okay, so we're going to start with the drugs. The ones that we're going to start with are atropine and scopolamine. Okay, all right. So what about those? Okay, let's begin with atropine, to be specific. Atropine, we say it's the prototype. Guys, do you know what's the meaning of a prototype?
Yes, like the first version of something.
Exactly. So this is the first version. It's the most famous. We will understand how atropine works, and every other drug in this lecture do act the same way. Okay? So it naturally occurs as an alkaloid, and it's found in a specific plant. That plant is called Atropa belladonna. Okay, so this refers, or the meaning is a beautiful lady. Why? Because back in the days, they used to have an extract of this, and this has atropine in it, and this would cause the pupil of the eye to be larger, which was regarded as a beauty sign. All right, so this is mainly it for why they call it Atropa belladonna. This is a tertiary amine. That means this is non-ionized or doesn't have a charge, which means that it's extremely lipid soluble. Does this tell you something about its ability to go to the blood-brain barrier?
Yeah, it can cross the BBB.
That's exactly it. All right, so it can have good absorption, it can go to the blood-brain barrier. Yeah, this is what the properties is about. However, the systemic administration, the half-life is about 2 hours. It's fastly metabolized and excreted, okay? But if you give it through the eye in the form of an eye drop, it can last more than 2 hours. Why? Because it can bind to the pigment that is present in the colored part of the eye, in the iris. Okay, do you know what's the name of that pigment?
The iris?
Yes, it's the name. The iris is the part of the eye that has the pigment. But what's the name of the pigment?
It's called melanin.
Bravo, melanin. That's right. Yalla. So it's called melanin. That's right. Atropine itself is a racemic mixture. Are you familiar with racemic mixtures and stereoisomers and all of these? You haven't taken those in organic, chemistry before?
Yes,
Okay.
we did.
Okay, sounds good. So racemic mixture, that means it's a mixture of two stereoisomers. One can rotate the light to the left, one can rotate the light to the right. Okay. Hyoscyamine in specific is the one that is responsible for the pharmacological effects of atropine, but we usually have atropine as a mixture, which is okay, and we still use it. Okay. Now, to remember the effects, I'm going to just name them here, and then we're going to go back to them again. Okay, so atropine overdose, or the effect in general, is hot as a hair because it raises temperature, decreases sweating, mad as a hatter, red as a beet, dry as a bone, and blind as a bat. What do I mean by this, and why am I saying it? Okay, let me open a new content slide so that we can take notes regarding this. Okay, guys, now I want you to help me out. Okay, let's name the effects of the parasympathetic nervous system. Now, what are we learning about? We're learning about muscarinic antagonists. So to be able to know the muscarinic antagonist, we need to know the effect of the muscarinic itself. So we need to remember them together. Okay, so guys, I want your help in remembering them. So what's the effect of the muscarinic activation on the eye? Meiosis or mydriasis?
Meiosis.
That's meiosis, that's right. Okay, so meiosis. So what happens if we block this? Mydriasis, that's right. Okay. What about the effect on the vessels?
Vasodilation.
Yes, if you activate M3, but do you remember, was there any sign of neurons that belong to the parasympathetic nervous system on the vessels? Did they have anything?
No.
No, right? So there's no innervation. Okay, so in general, there's no effect on the vessels. Okay, remember this. This is very, very important. There's no effect on the vessels. There's no, let me just clarify it. There's no direct effect on the vessels because there is an indirect effect somewhere. Okay, what else? What happens to the heart?
Decreases heart.
Decrease the heart rate.
Exactly, decrease on the heart rate. So guys, if I block this, what happens?
Increase heart rate.
Increase heart rate. That's totally correct. طيب, let me see who's awake. Yalla. Mustafa, are you with me? Mustafa?
Doctor.
Okay, Mustafa, can you help me in telling me what's the effect on the stomach and the intestines, on the GI tract of the parasympathetic?
There will be more motility.
Yes, 100%. There will be more motility. That's right. So if I block it, what's going to happen?
Less motility.
Less motility. Thank you so much. Okay, now let me pick somebody else. Sarah.
Yes, doctor.
So can you tell me the effect on the bladder? Is it more tight or more a muscle contraction or less muscle contraction and muscarinic?
Less.
No. So guys, you can tell me what's the effect on the bladder.
Contraction.
That's right, 100%. Exactly. Remember, in parasympathetic, this is urination that can happen. So this is contraction of the urinary bladder. So if I block this means that there is less contraction. Okay? So there are so many things that we can think about. But guys, tell me the effect of the muscarinic on sweating and secretions in general.
Increase.
In the muscarinic, what do they do?
Increase the
Secretion.
Increase
Decrease.
the secretions, increase them. So if I block muscarinic, if I use a muscarinic agonist, the secretions are going to be low. So that means the person is going to be more dry. Okay. What else? Okay, so guys, I forgot to ask you something else here. So in the eye, what's the effect of the muscarinic on the near vision or far vision? What does it do?
Near vision.
Near vision. Okay, so if I block this, that doesn't mean the person is gonna see far. No, but what's gonna happen to near vision if I block this? Will the person to be able to see something that's near? So it will impair near vision. Okay. All right. So this is mainly it. If I remember something else, I will add it in a bit. Okay. So, guys, tell me. Now you see, you have an idea what's the effect now of the muscarinic antagonists. Okay, so let's start first with the effects one by one. So you just mentioned that the effects on the eye, the ocular effects, is mainly mydriasis. So we agreed on that. And we said that the person is not going to be able to contract the ciliary muscle, so he will not be able to see near objects. Okay, and what do we call this phenomenon? This phenomenon is called cycloplasia. Cycloplasia is when someone cannot see near, right? And also because it inhibits secretions all over the system, the eyes will feel dry because the person is going to be dry all over, okay? All right, so guys, why do we need that effect? Why do we need to do mydriasis to the eye? Do you know?
Maybe some surgeries to the
Not always. It's an easier example. Guys, have you ever been to the ophthalmologist? Have you ever been to the eye doctor?
Yes.
So when you go there, does the eye doctor sometimes put some eye drops in your eyes, and then your pupils will be larger?
Yes.
And then you cannot see for a few hours. You only see far vision. You cannot look at your phone. This is why we use them. We use those for the physician to examine the eyes of the person. All right?
All right.
Okay, very good. All right, so guys, last time I just mentioned one idea that the drugs in the previous lecture, they were good for glaucoma. We haven't talked about glaucoma, right? I told you that we're going to skip this and talk about this later on. Okay, so it's a time to talk about this a little bit. Okay, so guys, what is glaucoma? You know, have you ever heard sometimes the pressure inside of the eye sometimes goes big? So there's a lot of eye pressure or hypertension in the eye. This is something, okay? So guys, you know, your eyes are never dry. Your eyes are always wet. Even when they're dry, there's some liquid inside of them. What's that liquid called? That liquid is called the aqueous humor. Okay, aqueous humor is a type of liquid that lubricates the eye, that keeps your eye wet. You cannot live without that liquid. And everyone has it, it's normal. At a certain age, sometimes that aqueous humor does not find a way out of the eye. Sometimes it gets stuck in the eye, or it gets overproduction, and there's a lot of it inside of the eye. When there's a lot of liquid, or there's a lot of that aqueous humor inside of the eye, what happens? It builds up, and there's a lot of it, and this what causes an increase in the pressure. Okay, it's not actually blood pressure, it's a pressure in the amount of liquid in the eye. And when the amount of liquid in the eye is very large, what happens? Sometimes it can push on the optic nerve, and that can cause very serious side effects. It can lead to blindness sometimes. Okay, is the idea of glaucoma clear, you guys? So glaucoma is the buildup of aqueous humor. Is it clear?
Yes, it's clear.
Very good. Okay. So guys, just simple words about glaucoma. Okay. So these drugs over here are not good for glaucoma. The drugs in the previous lecture, the muscarinic agonists, they're very good for glaucoma. Okay. So guys, drugs that cause mydriasis are not good for glaucoma. Can you take this as a note? Drugs that cause mydriasis are not good for glaucoma. All right? This is the first effects. Because do you have any thing to mention here? Do you have any questions? Okay, let's talk about the effect on the heart. The effect on the heart, overall, you mentioned that in the heart, the effect is going to be increase in the heart rate, which is 100%. Let's go over here. This is the effect. See here, the effect on the heart rate is increase. Okay, but what do we have over here? You see this slight decrease at the beginning? Guys, do you see this slight decrease over here?
Yes.
So there's, at the beginning, there's, at our low doses, there's a slight decrease, and then the effect is going to be higher at the end. Okay, so decrease at the beginning and then increase. But the global effect is tachycardia, okay? But it's slight bradycardia followed by very, very harsh or very strong increase in the heart rate, okay? That slowing of the heart rate or bradycardia can happen because of the blockade of autoreceptors at very low doses at the beginning, okay? What do I mean by autoreceptors? Can someone remind me what an autoreceptor is? Guys, I want someone to remind me of what autoreceptors are.
Is it inhibition of acetylcholine on the same receptor?
Do you remember it? We talked about this so much, and I spent so much time on it. So guys, if you don't remember it, please go back to the tables. We need to be familiar with the tables. Okay, so autoreceptors are the receptors responsible for the inhibition of signal. Okay, so we mentioned it as it was like the brakes of the car. When I activate them, they're like the brakes of the car. Okay? They stop the release of acetylcholine in this case. So if I block this brake, I stop this brake, what's going to happen to acetylcholine? It's going to keep moving on and on and on. All right, so this is exactly what happens. Acetylcholine will be released, and when acetylcholine is released, we get that small effect. But later on, all the muscarinic receptors are going to be blocked, and we're going to have an increase in the heart rate. Is it clear, you guys?
Yes, doctor.
Thank you for answering that. Okay, let's continue. Okay. The effect of the blood vessels. We did agree that the effect on the blood vessels, there's no direct effect. But guys, listen to what happens. We agreed that those drugs will inhibit secretions, including sweating. So what happens in sweating? What's the importance of sweating, you guys? Why do we sweat?
Releasing toxins?
Yes, to increase the heat, to have the heat move from our system outside our system. That's right. So what happens, guys, if we do not sweat anymore, which is the effect of the drug? We don't sweat. What happens?
Temperature is kept inside, so it's hot.
Exactly. So our bodies will retain the heat. There's no way to get rid of the heat. Sweating is not there anymore. So the body's temperature is going to go up. What happens when someone's temperature goes up? What happens to his face? What does it turn? What color does it turn?
Red.
Why? Why? Yes, the red, but why? What happens to the vessels in the face?
Because
Because of dilution. Dilute.
They will dilate, the vessels in it will dilate to try to get rid of the heat. Okay, so in the skin, the blood vessels will dilate to try to get rid of the excessive heat that is trapped in the system, so the person will look red. Okay, so guys, listen, the effect on the blood vessels is not direct, but we do have an effect that is on vasodilation of the blood vessels in attempt to try to get rid of the heat. Okay, and this is what we call as atropine flush. All right. Yes, we haven't mentioned the respiratory system. So guys, what happens with the muscarinic antagonist on the respiration or on the bronchi?
Bronchocontraction.
Yes, the muscarinic causes broncho constriction. But with the muscarinic antagonist, what happens? Broncho?
Dilation.
Excellent, bronchodilation. So the effect, guys, is bronchodilation. And what happens to the secretions of those patients?
Decreases.
Decreases, exactly. So this system, we have less secretions, which is actually very good if you're having a surgery and do not want any secretions in the trachea. So those drugs are very, very good. Okay. We did also mention GI tract. We have so the effect is antispasmodic. What do I mean by antispasmodic? So what's the meaning, guys, of a spasm? When I say a spasm?
تشنج. Like, is it hard
Yes.
to breathe or something?
It's simply contraction of the muscle. Okay, so when I say that a drug is antispasmodic, what do I mean? What does it cause the muscle?
Relaxation of the muscle.
Exactly, simply relaxation of the muscle. Okay, so when I say that the effect on the GI tract is antispasmodic, that means it calms down the GI tract. All right, so the GI tract now will not anymore be contracted that much. Okay, and What happens to the secretions over here? There will also be less. Okay, so less acid secretions, which is good, guys. Those are good in case someone is having trouble in their intestines and their stomach. So no more pain. Okay, and the gastric acid secretion will be less, so the person will be protected. Okay, the urinary tract, we said that this drug relaxes the urinary bladder and causes something called urinary retention. Okay, guys, let's explain now these. What do we mean by urinary retention? What's the opposite of urinary retention? Okay, guys, so what do we call it when someone is going excessively to urinate? When urination is excessive, what do we call it? This is called urinary incontinence. Okay? But when someone is having a hard time to urinate, so the person cannot urinate, this is what we call as urinary retention. Can happen because of so many factors. Okay, so this is an effect also of our drugs on the urinary system. Finally, the effect of the central nervous system is the following. Okay, so these drugs, they are toxic if given in high doses because they cause hallucinations, they cause delirium, the person will be confused. Okay, so the effect when we block the muscarinic receptors in the brain, the first effect, the person will feel sleepy. Then the person will sometimes, if I give in a higher dose, they might go into a what? Let me show you the scheme. Wait. Where is it? Okay, over here. So can you see, guys? So the person will feel tired, they will have hallucinations, they will have delirium, they might go into a coma in case of a high dose. All right, so the effect of the central nervous system, usually, we call it, they have a sedative effect, so they cause sleep, but if given in high doses, they can be toxic and they cause hallucinations and delirium. All right, this is a summary of the effects, guys, we just mentioned. Okay, now listen. Not all effects happen at the same time, depending on the dose. The small doses, they will cause stopping of secretions and stopping of sweating. A slightly higher dose, they will cause the pupils to dilate and the vision to start being impaired. Increase the dose a little bit more, the effects on the heart will start. The larger doses will have the effect on the intestines and the GI tract and secretions and everything. Okay, so in order to treat the urinary bladder, the person will have all these effects. But if the effect, for example, is on the heart, the person will not have the effects on the GI tract. You see, guys? So, guys, it's all dose dependent. Depends on the dose. And you're not supposed to know these. Just take a look. In low doses, there's an effect. If you increase the dose slightly, we will have more and more effects until if you give a very, very high dose, this can be toxic and this can put a person into a coma. All right? Do you have any questions?
No.
Is it clear?
Yes, it's clear.
Amazing. So guys, let's talk about the toxic effects of muscarinic antagonists. So the mouth is going to be dry. Why?
Because there will be less secretions.
Excellent, less secretions. We have urinary retention. Now guys, you tell me the reason behind that facts, okay? I'm gonna just hear from you, okay? So tell me, what's the reason behind urinary retention?
Won't have like the muscle contraction that we need to urinate.
Exactly. So what does it do to the muscle?
Relax.
must exactly relax the urinary bladder. Okay, so guys, tell me the effect on the skin. Why is the effect on the skin happening?
Vasodilation.
Yes, but yes, exactly. Why does vasodilation happen?
Because
Heating.
Because of the heating, yes. Why does heating happen?
to reduce it.
Because
Because
Yes,
there is no sweating, so
there's no sweating,
Yeah, no.
exactly. No sweating, exactly. This is it. Okay, what happens to the GI tract? Less secretions
and
and
less
less osmotic.
motility.
Yes, so see, guys, this leads to constipation. Okay, so no more movement of the GI tract. This leads to constipation. Okay, what happens to the bronchi? Dilation. What happens to secretions of the lungs? Decrease. That's right. What happens to the heart?
Increased heart rate.
Yes, increase in the heart rate. That's right. What happens usually to the central nervous system? What will the person feel?
Sleepy.
They'll feel sleepy. Okay, but if you're given a high dose, the person will start having. They will go into a coma, hallucinations, and everything. 100%. Finally, what does it cause to the eye?
Pupil constriction.
Opposite. Pupil dilation. So mydriasis. All right. We're done with the atropine. Now we're going to talk about very briefly scopolamine. Okay. So guys, scopolamine itself is a tertiary compound. What do we mean by tertiary compound? Tertiary compound, that means it can have access to the central nervous system. Okay, this is what tertiary means. Okay, so it's not charged. So it has very good permeation to the blood-brain barrier. Okay, it causes a lot of sedation, so the person will feel so sleepy. Okay, and can be given with anesthesia. Right? It has a longer duration and it has another name. So scopolamine has another name. The other name is hyoscine. Okay. What did they figure out to do? It's a very good drug. Okay. So, but the problem with it that it can go to the blood-brain barrier. So why not make it charged? Okay. Now this is a quaternary compound, quaternary ammonium compound, because it is charged. Now, if it's charged, can it go to the blood-brain barrier? Not anymore. So it can cause the effects, for example, on the intestines without having to go to the blood-brain barrier, without having to cause the sedation and everything. Okay, so this is the new drug, which is hyoscine butylbromide. Have you heard of scopinol before? Oh, buscopan? Yeah, those are famous drugs in the market. If you have taken them before, I don't know. Have anyone heard of those? Scopinol or buscopan?
Oh, I
No.
didn't.
No.
Anyways, you're gonna see them later on when you do your practice in the pharmacy. Okay? Yeah. Now, guys, now we're going to repeat, but now we're going to give examples of clinical examples. So let's revise again. So, guys, I'm gonna ask you just for us to memorize together. What is the effect on the respiration? What does it do to the bronchi?
Dilation.
Exactly. And what happens to secretions and mucus in the lungs? They will decrease. So guys, what do you think, in your opinion, what patients can benefit from this effect?
Asthmatic patients?
Asthma.
Yes. So patients who have problems in their lungs. Those can be patients with asthma. And there's another disease that's called COPD. Have you heard of COPD before?
Yes.
No.
So this is COPD, guys, is a type of disease that usually, there you go, COPD. So it is a kind of disease that comes in smokers. So patients who smoke, when they continue smoking for a long time, there will be inflammation in their lungs, and their lungs will start secreting a lot of mucus that can block their breathing, and this is called COPD. Okay, there. Now, the drugs that are used for the lungs, guys, do you think it's necessary to give them like pills or injections? To give them systemically, or what do you think? How do we give them?
For patients with COPD?
Inhalations?
Yes, exactly. We give them as inhalations. That's right. It's better to give them in the form of inhalation. Why? You've heard of all the side effects. We don't want them. So guys, the first drug is called ipratropium. Ipratropium is in the market is Atropine. Okay? This ipratropium is a quaternary. Okay, so guys, what do you think? Can it go to the rest of the system if we give it in the form of inhalation? Is it absorbed by the blood vessels?
No.
No. Why? Because it is charged. If it's quaternary, that means it's charged, so it cannot be absorbed. Okay, so this is given as an inhalation, and it can be given to patients who have COPD and patients who have asthma. Okay, it's not well absorbed from the lungs, so it does not have an adverse effect. We want the effect only in the lungs, which is good. Okay, the duration of action is 4 to 6 hours. So the patient has to take this how many times a day? 4 times a day. Okay. Is this specific to one muscarinic receptor? No. It can block all of them, non-selective, which is not good if we're talking about M2 receptors. Why? M2 receptors are the receptors that are present as autoreceptors. Okay, let me write this down. So those are the autoreceptors, which is not good, you guys. Okay, so this effect is not good. Why? Because it's opposite to what we want. If we block the autoreceptors with ipratropium, more acetylcholine usually will go out. And this is not what we want in this case. Okay, so is, in this case, you guys, M2 receptor blockade, is it something that we want?
No.
No, it's a problem. Okay, so keep this in mind. So ipratropium, although it is good, but it has this issue, and it has the issue that the patient has to take this 4 times daily, which is too much. Then there comes the second set of drugs. Tiotropium does not target M2, and it can be taken once daily because it has 24 hours effect. Aclidinium and umeclidinium also have a longer effect, doesn't have effect on M2, and they can be taken twice daily or even once daily. Is it clear?
Yes.
Yes.
All right, this is it for the first effect. The second effect is on the, what is this system?
To urinate or?
Yes, exactly. This is the genital urinary tract. So guys, remind me of the effect on the bladder. What was the effect on the bladder? What did the system do? The drugs, what did they do to the urinary system?
Relax the muscles.
Relax it. That's right. So guys, this, because it relaxes the urinary bladder, okay, it's good to be used in case of an overactive bladder. Why? Because it will relax it. It will make it work less. Okay, so in a nutshell, what are the symptoms of an overactive bladder? What will the person feel if they have an overactive bladder? Number 1, urinary frequency. Okay, so the person will have to urinate multiple times a day, more than usual. They will also have nocturia. So guys, normally, does the person usually wake up at night to urinate like 5 or 6 times?
No.
Normal.
It's not normal, right? So this is what the person will feel. So this is a person with an overactive bladder, they will have this. The person will have urgency. So they suddenly feel that they want to go urinate, right? And incontinence. Incontinence, that means the person does not have any control over his urination. Okay? So in this case, what is the solution? Is I want to give something that can stop the overactivation of the bladder and can relax the muscles of the bladder. What are those drugs? You have a list of them over here. Okay? Guys, let's take a look at the adverse effects. Tell me if they make sense. Xerostomia. What's the meaning of xerostomia?
Should we memorize all the names of the drugs? Examples of...
Yes, you should know them.
Okay.
All right. So listen, guys. What are the adverse effects? What's the meaning of xerostomia? Do you know?
Yeah, dry off the mouth.
Dry mouth. That's right.
Yeah.
Does it make sense that these drugs will cause xerostomia?
Yes, because it's decreased the secretion.
Bravo. Excellent. Decreased secretions. The person will have blurred vision. Why? Guys, all these we talked about. We're just revising. We talked about this. Why does the person have this blurred vision?
Because mydriasis.
Mydriasis, that's right. And
Yeah.
what happens again to the patient? What happens to the near vision?
Impair near vision.
Reduced
they
or
can
obstructed?
see.
Exactly, it will impair it. Okay. What happens to the GI tract? What will the person feel in their GI?
Less secretions and motility, so constipation.
That's right, constipation. And finally, what's going to happen to the person if these drugs can go to the central nervous system? The person will feel dizzy, they will feel sleepy, they will feel all of these effects. All right? Now, I guys mentioned some of the effects, some of the drugs over here. So the first one is oxybutynin. Oxybutynin is this drug, okay? So it's one of those drugs that are used to treat an overactive bladder. It has a very high incidence of xerostomia, so it causes a lot of symptoms of dry mouth. And it's usually metabolized by enteric and hepatic CYP3A4. Guys, what's the meaning of enteric?
Stomach inside the...
Yes, inside the intestines and the stomach. Okay, so it's metabolized in the stomach, in the intestines. Enteric is usually in the intestines, okay? So it's metabolized in the GI tract before it goes to the blood. So does this tell you something about the dose that we need to give orally? What do we need to give for the doses orally? High or low?
Hi.
High. Why? Because it's broken down. So I need to give a higher dose of it for me to get something into the blood. Okay. The second one is trospium. Trospium is better than the other drug, and it's usually eliminated by the kidneys. Okay. Guys, why do I need to know this? Like, what do I deduce from this effect if it's primarily eliminated by the kidney?
As highly charged?
No. What do I do? So let's say someone who has some kidney failure. Can I give them this drug?
No?
No, because
No, can't.
the drug will not be eliminated. 100% correct. Solifenacin and varifenacin, those drugs, let's say they're cousins if you want, they're related. But these drugs have a specific effect, which is on M3, which is good. We rarely see any drugs muscarinic that are selective. But having an effect on M3 is even better because this is the effect that happens usually on the urinary bladder. This is once daily dosing, which is good for the patient, and it's metabolized by CYP3A4. Varifenacin also is selective, and it's also metabolized by 2 enzymes. Okay. Finally, these drugs, this is an active drug, and physothiazide is a prodrug, okay, that is rapidly metabolized as well. All right. This is what I want you to know about those. Okay. So What do you think, guys, of the effect on the GI tract? So what does it do to the GI tract? Or why do we use it for the GI tract?
Reduce the
Reduce what?
secretion.
I can't hear you. Reduce what?
Secretion.
Reduce secretions. Yes, that's right. Reduce secretions from the acidity of the stomach. What else? What does it do to the movement of the intestines? What does it do to the pain if someone is feeling it in the intestines?
Less.
Yes, that's right, Safa. Thank you. So
less
that's much.
diarrhea.
That's less secretions, less movement of the intestines. The person will no longer have pain if they have it. So guys, pain in the intestines is caused by contraction of the muscle. So if we relax the muscles, this is good. So number one, patients with peptic ulcer. Guys, are you familiar with this word, peptic ulcer?
Yes.
Okay, so patients with peptic ulcers, they have a problem in their acidity, so it's good to give them for those patients. But these have so many side effects. So now we have different classes of drugs that we're going to take in pharmacology too. Those drugs are called H2 receptor antagonists and PPIs. Okay, so these drugs are the new classes. We don't use this anymore for peptic ulcers. Okay, but we have specifically some drugs like pyrazipine and talanzapine. Pyrazipine and talanzapine can help with certain types of ulcers. If you find them somewhere, you know that these drugs are used for ulcers. Okay. Now, glycopyrrolate. Glycopyrrolate is a drug that has a quaternary amine. That means it does not go to the central nervous system. Okay. It is good for peptic ulcers, but it can be also used before surgeries. Guys, why do we use this drug before surgeries? What's the problem about surgeries and secretions? Is the person who's under surgery, is he awake to be able to control his secretions? If, for example, saliva comes up, or what is the wrong with secretions? Usually those are really, really problematic because the person can choke on those without being even aware. Okay, so we want less secretions from the saliva and less secretions even from the respiration tract. So these drugs, they cause decrease in secretions and they're extremely good in that case. Also, they can be used to prevent drooling. So guys, some patients, they have neurological problems. So they have like an issue, for example, cerebral palsy. So those are children that are born with problems usually in the brain. Okay, so because of these issues, they sometimes keep on drooling the whole time. They keep on salivating, so they have secretions of saliva from their mouth the whole time. Okay, so in order to control this, glycopyrrolate is a drug that can be good. Okay. Now, dicyclomine is a drug also that can do what usually? It can, as we said, it can stop usually movement of the intestines, which is good in case a patient has diarrhea. Okay, and diarrhea that is associated with a specific type of disease. Guys, have you heard of irritable bowel syndrome or IBS?
Yes.
Okay, so guys, IBS is a disease, or let me say it's a condition that happens to people at any age, and it's usually something related to symptoms are bloating, it can be diarrhea or constipation depending on the patient, and it's usually associated, guys, with stress. Okay, so patients have it when they're stressed usually. Okay, so if the patient has diarrhea predominant IBS, they can take this drug and they will be fixing their diarrhea. Okay, because now the intestines do not move anymore, the diarrhea will stop. But let's say an IBS patient has constipation, it's really a bad idea to give dicyclomine. I don't give in patients who have constipation because their constipation is going to be worse. All right? Guys, do you have any questions?
No.
I'm very good. Now, what about the eye? Guys, we just mentioned the idea. So patients who go to the eye doctor or ophthalmologist, okay, they will have to be examined. Okay, so the doctor has to see the inside of their eye. For them to be able to see the inside of their eye, there have to be some sort of mydriasis. Okay, so they have to be seeing inside of the pupil. Okay, so these drugs they cause mydriasis and cycloplasia. Cycloplasia means, what does it mean?
Weak near vision.
Exactly, the person is not going to be able to see near vision. Thank you so much. What are the drugs? Homatropine, cyclopentolate, and tropicamide, which is the most used. Okay? Those are the drugs that we use. The patients put them in the pupils of the eyes. Usually the patient puts them in the form of eye drops, okay, not pills. All right. Do you have any questions? Are you still following?
Yes.
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 Is it hard?
Yes. Too hard.
Kazim, did you study the tables?
No.
That's why they're hard. You guys, please make sure to refer to the tables. They will make your life easier. Remember, I'm just revising things from tables, okay? So guys, I will just explain. Awesome, we're almost done with the lecture, okay? So, do you know what motion sickness is? Guys,
Does it usually happen in the car?
Yes. So motion sickness happens when someone, for example, rides in the car and they become very dizzy. Any one of you has motion sickness? They feel annoyed by the car rides?
I do.
Yes.
That's Rawan and Reem answering?
Yes.
I do as well. It's not that bad, but I do have motion sickness. Whenever I ride a car, sometimes I get too dizzy and it becomes, the person will feel sick. Unless I drive, that's the only time I don't feel anything. But if someone is driving and I have to sit next to them or even in the back seat, that's even worse. So that's only 2 people having motion sickness. Wallahi, that's not a lot of people. Or the others are sleeping and not answering, probably. I don't know. Anyways. Okay, so how do we treat motion sickness? Guys, the drugs over here that we use in this class of drug are very good for motion sickness. Okay, so guys, in your opinion, for a drug to be able to for me to consider it good for motion sickness, do you think it should go to the central nervous system or not?
It should.
It should.
Yes, it should.
Yes. So the effect, for it to have an effect, it should go to the brain. Okay, so even if the person has side effects, well, those side effects should be there, right? Because they are the ones that cause the effect. Okay, so scopolamine is one of those drugs, and it can be usually given in the form of transdermal patches that usually can be put behind the ear, and they can be left for 72 hours. Okay, now guys, let me tell you something. For you to be able to treat motion sickness, the person has to be given the drug before they go into the car. Once the motion sickness have happened, we cannot treat it anymore. All right? So I have to give it before the person starts with the motion sickness. Okay? Now, what are the side effects? Same all over again. Dry mouth, blurry vision, drowsiness, mydriasis, all of the side effects that we previously mentioned. All right? Do you have any questions? Guys, are you tired?
Yes.
Yes. Go ahead.
The motion sickness is also from the sea or a boat when you go.
Yeah.
Same.
Yeah, same, yeah.
Okay.
100%. Guys, are you tired? Shall we stop? Will I continue in the last few slides?
Yes, we stop.
We stop, Kazim? Okay. Kazim said we stop.
Yes, we stop.
Let's stop here.
Doctors, there
That's-
are many names of the drugs that are just confusing.
Yeah, I know. You need to know them.
Yeah.
I'm sorry. But all of those, you'll see them in the pharmacy. All of them. Okay? So,
Excuse me, doctor.
yes, Timo.
Oh, sorry. You said once the motion sickness happens, you cannot treat it anymore. Like, how do you mean?
So, it's optimal for a person, if you know someone gets dizzy, give them the drug before they go into the car, not after they get into the car starts feeling sick. It's much harder to treat it if the person starts feeling sick.
Okay, so it's harder, but not impossible.
Yeah, it's hard, definitely not impossible, but the person will take so much time and they will feel. Sometimes patients do not, if they vomit, they will vomit. You know?
Mhm.
So it's
Okay.
more optimal to treat before, okay? Prophylactically. The drugs are prophylactic, not treatment. Okay, so there you go, prophylactic use. It's less effective, much less effective after nausea and vomiting happens, okay? Do you have any questions, you guys?
No.
Sorry, doctor,
No.
was just about the midterm.
Yes, Ali.
When is it gonna
Ali,
be?
did you receive an email from the registrar today?
Actually, I didn't check it.
Can you check what you received today?
Okay, I'll check. So, is it about the midterm?
Yes.
Okay, thank you, doc.
It's about postponing things on campus. Guys, did you receive anything from the registrar?
Yes.
Yes.
Days and person classes are cancelled.
So, yes, only online classes. Everything, laboratory, midterms, clinical sessions, everything has been postponed. Okay, so until we get a sign that we can go back to normal, then we're gonna see. Your class is on the safe side. Why? Because we already did a midterm. We have an assessment. Okay, we have a grade for each one of you. So you're safe, and you're on the safe side compared to the other classes which you didn't have
Okay, doctor. Thank you.
any exams. You're welcome. You're welcome.
So, doctor, then this week there's no. In the other
Please,
classes there's.
let's refer to the registrar. Registrar said which days?
Just today, postponed.
Yeah. Okay. So wait until the registrar tells you. Okay. The
Okay.
registrar will tell you day by day. Okay. But today, this is the plan. We'll see what happens tomorrow, after tomorrow. Okay. And then accordingly, we will arrange our activities.
Okay.
Okay.
Because the news doesn't go well.
That's why, exactly. So this is why I'm telling you, let's just refer to things on daily basis. Let's not make decisions in the near future, okay?
Okay, thank you.
All right, guys. Yalla. I'm going to end the session. Have a good day. And let's all pray that this is over and we can go back to normal.
Thank you, doctor.
Yalla, have a good day ahead.
Thank you.
Bye-bye. You're welcome.
Thank you, doctor. Have a great day.
Thanks, doctor. Have a great day.
You too. You're welcome.